may have received fax flyers like this one at home or your business. Some of them are on telephone poles throughout the city. They promise to fully cover you and your family for doctor visits, surgical procedures, dental visits, prescription drugs, and eye care. Some plans may cost you only $60 a month. For the entire family, just $20 more. If you had no health insurance, you might give such discount offers a second look. Many people do, and go even further.
And this sounds pretty good. And if I can at least get you a discount, it's something. So it's not for stupid people that think that fall for this issue. And it's kind of like selling water in a drought.
To find out what might happen to you or someone else who literally buys into these plans, we opened up a checking account at a local bank and made a call.
Well, what we are is a professional medical saving program. We offer the same PPO rates that other insurance companies use, but by eliminating the middleman, we are able to pass the savings directly to you. We have more than 6 million doctors.
The operator told me my professional medical savings plan was being offered by American Health Benefits, headquartered, she said, out of Dallas, Texas. I was purchasing a medical plan with broad coverage called Smart Healthcare Solutions.
We cover 80% medical lab and x-rays, 60% dental, 65% vision and hearing, 60% chiropractics, and 60% prescription.
The operator wasn't interested in my height or weight, pre-existing conditions, if I was a smoker, if I drank, or about my family health history. What she was interested in was having me sign on.
Press pound.
And with the help of simple prompts on the phone, gain access to the checking account.
And then it's going to give you a 1-800 number at the end, okay? So don't hang up.
Okay. Contracts with our providers ensure that you receive the deepest discount available. However, we are not a payer. Discounts given through provider contracts vary depending upon location and procedure.
Down.
By entering numbers and codes over the phone, American Health Benefits now had access to the account, which would mean they could take their $110 one-time enrollment fee out of the account and then $59.95 every month for coverage.
It'll be taken out on the next Wednesday.
What will that money get me the next time I go to the doctor or hospital? We'll show you in my next report. Terry Russell, News Channel 8.
This is Terry Russell calling from News Channel 8 in Reno, Nevada.
Uh-huh.
We purchased a Smart Healthcare Solutions card from your company about a month ago.
Jennifer passed the call on to a man named Bob.
Okay, I've got Ricardo Garcia.
They don't take your card.
Okay, when you say they don't take our card, what do you mean by that? Did
They
you
don't
go into the
accept
doctor's
their.
office yourself?
Yes. I talked to their business manager.
Okay, which was Dora?
No, her name is Leanne Sullivan.
I have to explain to them that they don't have coverage and they basically have paid for nothing.
In the Smart Healthcare Solutions Handbook, under member terms and conditions, the company states neither it nor its affiliates are liable for any payments to a provider. But when I bought the policy, that wasn't what I was told.
We cover 80% medical lab and x-rays, 60% dental, 65% vision and hearing.
That is definitely not true. We do not pay. We're not a payer. That's exactly right.
Why did they tell me that?
Excuse me?
Why did they tell me that they would pay 60% or 80%? I have actual verbatims of what they told me. Because
I honestly don't know exactly. I don't know. I was not in that conversation.
It's important to remember Smart Healthcare Solutions isn't an insurance company, and in its literature and card, they state that very clearly. What they will tell you, though, is they are affiliated with networks which provide discount fees. While that may be true, those networks are insurances. Smart Healthcare Solutions is not and cannot guarantee lower rates.
You're not an insurance company, and B, you're not licensed in the state of Nevada to do business as required by law. So they don't have to even give anybody a discount. They don't have to give anybody a discount.
I understand that, ma'am.
The Army's all-purpose vehicle, the Humvee, is a workhorse, but with canvas doors and an unarmored body, it was never intended to protect its occupants from hostile fire, or the IEDs, the improvised explosive devices encountered in Iraq. The consequences have been deadly for American soldiers. Private First Class John Hart was in an unprotected vehicle when his unit was ambushed and his Humvee riddled with machine gun fire.
He called us the week before and said that they were being sent on missions of increasing length in vehicles that had no armor protection.
He wasn't alone. According to the Army, as many as 190 soldiers have been killed in attacks on unarmored vehicles, and less than a quarter of the 15,000 Humvees in Iraq are armored. In some cases, the soldiers themselves have rigged makeshift armor, welding plates, or hanging body armor on the sides of their Humvees.
So in essence, you're making your own armored trucks?
Yes, ma'am.
Think this will save some lives?
Oh, yes, ma'am. It already has.
Last month, this assembly plant at the Sierra Army Depot began turning out armor kits and shipping them to Iraq. Armor steel panels, doors, and windows assembled here are now protecting some of the soldiers there. The work continues today, but it's only part of the role being played by this sprawling base north of Reno. Its newest mission is receiving and storing some of the most heavily armored vehicles in the Army. These M1 tanks served in the invasion and show the wear and tear of combat and heavy use. They're only the first of what will be hundreds of vehicles to be brought here, either to be mothballed for future use or to be picked apart for reusable parts.
It's a very important mission for us, and it's good. I think it will mean more jobs later on as we kind of expand in that mission.
Weeks ago, these employees of the Sierra Army Depot at Herlong were assembling the first of thousands of armor kits to retrofit the Humvee vehicles used by our troops in the Middle East. Today, a half a world away, they're installing them. When they were putting these armored doors together back home, they knew it was important work. Being here and completing the job makes that all the more clear.
When you see the look on one of the soldiers' faces, that it's, hey, we're being protected a little bit more.
Those are the most appreciative people in the world when they know they can come in here and drive out a lot safer.
They really appreciate the armor. There's a lot less fatalities now that we have these armored doors.
For these workers, being here and completing the job is satisfying, something they'll be able to tell their co-workers about back home. But for the soldiers who will drive these vehicles in Iraq, this work is literally a matter of life and death. 1 in 4 casualties in Iraq has been in an unarmored vehicle. Besides small arms fire and rocket-propelled grenades, it's the improvised explosive devices, the IEDs, that have proven particularly deadly. But in an armored Humvee, it's a different matter. This is what an IED can do to a Humvee. The good news is the soldiers in here had armor steel and bulletproof glass between them and the explosive device. It worked. At Camp Arif John, Kuwait, with photographer Justin Cano, Ed Pierce, KOLO, News Channel 8.
This letter I got is extremely advanced, progressively terminal.
That's how some medical experts describe George McMahon. Born 49 years ago with nail patella syndrome, he says he's spent most of his life in pain.
In intense pain. Things pulling that shouldn't pull, and bloody urine. I can have a lot of things go wrong all at once. My kidneys and liver are also involved in this nail patella syndrome. I have a fractured spinal column, and I have slip disc, and I have joints that are deteriorating most of the time, similar to arthritis.
At one time, he was given only 5 hours to live. That's when his former recreational use of marijuana turned medicinal.
All of the things in my life are possible because I got to smoke marijuana. I'd have been dead. There wasn't any doubt about it.
George lives just on the outskirts of Tyler, Texas. Texas, just like Nevada, has no medicinal marijuana law. But that doesn't stop George from lighting up at least 10 times a day. And it's all perfectly legal.
The feeling come up with you as you smoke it. You begin the feelings within 15, 20 seconds. So within 5 minutes, all the nausea will be gone. The pain won't all be gone, but within 10 minutes it will be.
George is one of 8 people in this country who smokes marijuana openly and legally with the help of the federal government. In 1988, he applied for and got into a now defunct federally sponsored compassionate use program, a program that supplies government-grown marijuana from this farm at the University of Mississippi free of charge. The Bush administration stopped the program back in 1992, but George and 7 other Americans were grandfathered in. The farm can grow up to 6 acres of pot. Currently, only 1.5 acres are being used. But that can produce up to 60,000 cigarettes.
It comes with seeds and stems.
George was an Iowa resident when he started the program, and the rules haven't changed. Even though he now lives in Texas, every couple of months he drives back to Iowa to get his pot from a highly secured pharmacy. He can't sell it, share it, or grow his own under the program. He estimates he smokes about 12 joints a day.
It's not psychological, it's physical reaction. There's something going on in me when I smoke marijuana that doesn't go on in me when I don't.
And just what is that physical reaction? And could marijuana help more than just the 8 patients on the program? For years, much of the marijuana grown in this Mississippi farm was used to show the adverse effects of pot. But just 3 months ago, the National Institutes of Health announced it would start taking grant applications that look into the benefits of medicinal marijuana. If those projects pass peer review, this government pot could be supplied for a fee.